Hi, everyone. My name is Asia Chester. I'm a rising junior at the University of Miami studying biochemistry and nutritional science. Today, my project is about evolving health communication to fit the needs of today. To introduce the topic, public health and health communications have grown in prominence due to the COVID-19 pandemic, as we know. The U.S. Department of Health and Human Services defines health communication as the study and use of communication strategies to inform and influence individual and community decisions that enhance health. It's important to understand that health communication and health literacy goes beyond just the individual. It's the overall community and population. The efficacy of health communication is dependent on methods of communication and your target audience, which I'll get into later. So this summer, I interned for the New York State Public Health Association, which is an affiliate of the American Public Health Association, or APHA, and it represents health professionals across the state, including New York City. The mission is to promote and protect the public's health through professional development and networking, advocacy, and education. So this summer, I focused on health communication and professional development in my work. I help administer the organization's website and social media platforms. You can see some of the graphics I made to the left for their webinar series. I help promote the health newsletter and webinars, and I conducted research for funding opportunities and potential hybrid conference formats. In terms of this project, I conducted a literature search on health communications as a whole. I used specific keywords including health communication, social media, COVID-19, and HIV and AIDS, because I wanted to see how certain infectious diseases and pandemics that we've seen actually do affect health communication and make it very relevant to today. I also looked up social determinants of health and resistance to health communication. I did general searches for data, statistics, and graphics to help support this presentation, and I used my intern experiences in my main research paper. I found in an article that the COVID-19 pandemic brought a complementary infodemic where there was an attack basically on health information and communication that we put out. Many of the papers I found spoke about targeting audience to meet their literacy needs, linguistic diversity, race, ethnicity, age, gender, any other demographic information or identity-based information to have the best type of communication. In addition, the research found that social networking sites can enhance effective communication and professional opportunities among health professionals, which is very relevant to what I did through my internship, which was focused on interprofessional communications. In addition, HHS, Health and Human Services, found that theory-based health communication is very valuable. One of the papers I found broke down 3 different models you can use to approach health communication. One of them being activation models, which focus on sensation seeking. So you have high sensation seeking individuals that look for thrill-seeking activities and risk-taking. And then you have low sensation seekers who oftentimes are engaging in less desirable health behaviors, and how you can use communication to target those populations. Then you have extended parallel process model, which relies on fear tactics and scare appeals to get their message across. So you can think of any of those anti-smoking ads that you see that show you the negative and scary parts of smoking. That would be part of this model. And then you have the Fisher's narrative theory, which relies on individuals telling their own narratives about certain health behaviors, and all of them have the goal to improve health-related behaviors. This is an infodemiology loop. So infodemiology is the epidemiology of information. And basically it shows you how cyclical communication can be and information can be. So if you think of it starting from any researcher or public health professional and policymakers, it's going to eventually turn into policies and laws and then affect the population. And that'll affect population behavior and attitudes towards those policies. And then it ends up influencing back into the policymakers and becoming a loop. And all of that is seen through different types of communication, as you see in the bottom left. Second diagrams on the left is a graph showcasing how social media has grown from 2015 to 2020 globally. There's about 3.7 billion people in the world that are using some sort of social networking site. And that's about 50% of the population globally that are using social media, indicating why it's so important to rely on this medium in terms of spreading health communication and information. On the right, we have the percentage of Americans that are using social media, and these are individuals that are at least 13 years of age, and that's 70% of the country using social media. To sum everything up, again, the efficacy of health communication relies on what methods you are using and the characteristics of your target audience. The infodemic that we've seen with COVID-19 highlights the major deficiencies that we are currently facing in terms of health communication. So a sharing of a lot of false information and unsourced recommendations on health, even on wider scales, unsourced recommendations for public health reasons. We've seen a lot of issues with that. And with the rise of social media can spread information extremely fast and at extremely wide scale, which indicates why it's so important to have collaborative efforts in terms of communication and health professionals communicating to each other to make sure the appropriate messages put out there and the citizens have the appropriate health behaviors and outcomes that we hope to see. There's a bunch of factors that play a role in a patient's reception to health information. Language is one of the examples. In one of the studies I found, they looked at West African countries where there was about 16 countries studied. And in those countries, there's high degrees of linguistic diversity. So the researchers wanted to see in these public health plans that are addressing health issues, specifically HIV and AIDS, are they including anything about multilingualism? And the majority of them didn't. About 2.5% actually address multilingualism, despite it being a place with high linguistic diversity. Even here in the United States, we have a lot of people that have limited English proficiency, but a lot of our health communication is actually focused and put out in English. So how can we address this issue by providing different options based on where you live and the populations in that community? Then we have literacy. So it is important in terms of health communication to lower the literacy rate to make it more accessible for people to understand. We've seen that a lot in the reliance this year from the CDC, putting out a lot of imagery and infographics for people that aren't going to understand a lot of high scientific jargon. Then it's important to focus on race and ethnicity. I found another study that saw when individuals are looking at models that represent them, for example, if an African-American man is looking at a model of another African-American man, he's more likely to identify with that model, and that'll have an influence on his behavior moving forward and improve health-related behaviors. In addition, you have age and geographic locations that are going to play a role in how somebody will perceive health communication and how you can actually target that to those population. Health communication is not limited to just health professionals and patients speaking to each other. It's important to know that every health decision and the general public health will improve if professionals are talking to each other, having opportunities to educate each other, and further networking and professional development, as I saw with my internship. They can learn more and improve the overall patient experience as well. Finally, communication must be adaptive and targeted to have the best outcomes. I just wanted to say thank you to the SPHSP staff at Columbia, RTAs and RPIs, and everyone that presented for our program. Thank you to Erin, Missy, Jen, and Jamie of the NISFA team as well. It's been a great summer. This is all my literature cited. Thank you so much for this opportunity, and I hope everyone stays safe.